So I'm Simon Gregory, I'm the Director and Dean of Education and Quality of Health Education England across the Midlands and East. We currently have 4 Directors of Education and Quality, and that's because quality is the heart of everything that we do. I think it's vital that the patients that the NHS is here to serve and the public that we're here to serve get the very best care that they can for the resources that are available. To do that, we need to have the best educated workforce, and in that we need to ensure that we are giving them the best education and training that we can in the best environments that we can, and that takes a lot of effort and a lot of responsibility to make it really work. But the key thing there is that we're supporting those environments to be really great places to work. The HE Quality Framework has been developing over a few years. The initial development was actually here in Midlands and East when we had 3 quality teams all working to slightly different modus operandi. And it meant that we couldn't really compare one to another. It was like comparing apples to pomegranates to oranges. And it was really important that we were consistent in how we worked, but also that the trusts and the practices, whether dental practices or general practices, all the people that we work with, they knew that they could have consistency from us as well. We started working together on that as our 3 quality teams, and really quickly we started to find that we could work very well together and there were opportunities. But then we thought, hang on a minute, if we had these differences and there's that much benefit from us working together, are we in danger of just creating a new Midlands way of doing things and then the rest of the country being different? So we took that to the National DEC team, and very quickly Wendy Reid, as the National Executive Director of Education and Quality, said we should do this nationally. So we then paused the Midlands and East work and moved on to a national piece of work to move to one quality framework to benefit the whole of England. Learners are absolutely key to this framework because they're, along with the patients that we're ultimately here to serve, they are our very purpose. We need those learners, whether it be apprentices, whether it be undergraduate students or even postgraduate trainees, all to feel like we are here to serve them and to help them be better healthcare professionals in the future. So it's vital that they can interact with the framework. So if we take the example of postgraduate medical doctors, within those schools that they're in, we have training program directors and we have heads of school. All of those are now familiar with the framework and working in that, and are connected to the quality team, and therefore could be a route of escalation. Equally, all the trusts have directors of education or directors of medical education or tutors, and all of those are routes to go. It's slightly different in primary care and dental, but there again, people will have their training program directors that they can escalate through to. I think the benefit to providers, whether that be trusts or practices, is actually key here. It's the big change from us being seen as a quasi-regulator that was just applying a framework to the move towards the intensive support framework with its various levels. That this should not be us telling people this is wrong, what are you going to do about it? Much more, it should be about celebrating good practice, sharing good practice, because there is so much good that goes on and so many very good people. But where things are not necessarily right, it's about identifying that and helping people to find the solutions. I also hope that the information we provide will be used, whether it by practice clinical leads, whether it be by directors of nursing, medical directors, directors of medical education, or actually trust boards, to ensure that they are understanding what's going on, using this as a resource to give them an insight. Often our learners are described as the canaries down the mine of the NHS. I think it's really useful to have these bright young things that are moving around between practices, between hospitals, between community settings, and seeing things that are different. Committed young people that want to make the NHS better and want to serve and want to be listened to. All of these are fabulous resources for boards, for partners, for those leading on quality of care. My message would be is that quality is the responsibility of all of us. We have a duty to ensure that every single patient gets the best care that they can get, and we have a responsibility to ensure that our NHS remains the best in the world, and that every penny that comes from the taxpayer is well spent. I think we can all be proud of the NHS, but we should not sit on our laurels. We should continue to strive to make it the best that it can be.